What we used to refer to as ultrasound is now being referred to as sonography. And these sonography students begin their program learning about vessels, veins, and internal organs from Professor Dolores Aran, the program director for surgical technology. And when necessary, she uses props. Once they learn the basics, they move on to more advanced equipment. I asked for an explanation. All right, so tell us how you prepared her and what are you about to find out?
I prepared Lindsay for a regular abdomen examination, so we've got towels top and bottom, and she's got gel on her stomach already because that helps carry the sounds. And then we always start off at mid-abdomen to check the pancreas. And check everything, check for size, make sure it looks right on the screen, pick color-wise, not too dark, not too light. And check everything's blood flow, measure everything. And once the pancreas looks as it should, start scanning the liver from left to right, checking for size, color, blood flow, etc. Take a deep breath in. So this is what we like to call the bunny sign, which is 2 hepatic vessels. This is the inferior vena cava, hepatic vessels going into the liver. Breathe. And we see diaphragm, which is this white line. You can actually catch a little bit of the heart beating, even though we don't really look at that.
It certainly appears as though these students are on their way to sonography careers. And Chairperson Becky Miller makes sure the program is accredited.
We follow curriculums that are set by our professional organizations. We adhere to those curriculums fairly well. That's one reason why we have accreditations in both our ultrasound and our radiography programs. We also, during their last semester, try to help them prepare as far as review-wise. They do get review manuals and things, and we go over those. The ultrasound and the RadTech programs take national boards, which allows them to work anywhere in the United States and in some of the foreign countries that it's recognized. So it is an exam that we do try to get them very well prepared to take. I want the public and I want the students to know just really how hard our students work to get through these programs. They are not easy programs. Miss Stenger, who you saw earlier, Miss Stenger and I teach in the radiography program.
We have a 3-hour lab for the one class, which is procedures and positioning, which is when they learn what to do in the hospital, how to move the patient, how to get the right x-ray. It's a 3-hour lab, but we split the students into 2 groups because it's just too many. So we have 2 3-hour sessions. Well, typically we start in the lecture and we teach verbally what has to be done, and then they actually come in either one of these rooms and they practice on dummies or phantoms. They practice the positioning. They also practice on each other because we cannot do x-rays at school because it's not legal. A doctor has to be present. So we can't actually take x-rays on people, so that's why we have the phantoms. Once we're done with the patient positioning, we go in behind the wall and we take the x-ray, produce the x-rays, and then we take the image. And this is all computerized. Everything is computerized now. We have no more film. All of our sites have gone to digital or computerized radiography. And this is our digital machine, which is brand new since we made the move over here. It's a brand new digital, top-of-the-line technology. Once we do the x-ray, we have to be able to determine if the x-ray is good quality. Can it be sent to the doctor? Can the doctor make the diagnosis? So we have to learn, is the correct anatomy showing? Is the positioning what we need to demonstrate what the doctor needs to see? So it's not just about taking the x-ray, it's also about determining if it's a quality radiograph. And that's what they're learning outside. They have to know the anatomy and they have to know if it's good or not. Right now, when they graduate, they're an entry-level radiographer, and they can go into any hospital, doctor's office or clinic and start doing diagnostic x-rays and fluoroscopy. Typically, they all start out that way, and then the good thing about this program is you are on the job trained in a lot of different areas as far as CAT scan, magnetic resonance, which is MRI, special procedures. So there's a lot of different ways they can go, a lot of different paths, but they generally start as an entry-level radiographer. Everything from day one is all preparatory. We have, you know, basically everything's cumulative. Everything builds on everything else. So all through, we do a lot of review, and in the last semester, we actually have, you know, practice registries that just to see where they are and what they need to do more of, study more. So we do, it's all prep. It's all prep work from day one.
I work in the X-ray department at Georgetown Memorial Hospital in Georgetown, and I decided that I love the X-ray department, so my future plans is to become a radiology department director. So instead of me just starting there first, I want to start like on the base level as an X-ray technologist and work my way up to the top. So I'll become an X-ray technologist and, you know, train in different areas, like become a supervisor over our area and work my way to the top. So that's why I decided to come here.
Well, I've been going to Tech since I got out of high school, and I kind of went into the different fields. I wasn't sure what I wanted to do first, and once I went to observe, I kind of felt like X-ray would be more of my situation because I wanted hands-on with patients, but at the same time I didn't want to get too personal. Just, you know, I would like to help them out, but not in a way that I would have to get personal with them and, you know, like get too close to them, too attached.
One of the things I ask people to do is make sure you do your homework. There is so much information that you can get out there on the internet before you come into a program that there's no reason for a student not to really understand what's going to happen. It's not just that we're going to put a hand down and take an x-ray of it. They need to be involved in everything, and the reason they would get to go to a morgue or at the time get to go down there is because sometimes after an accident, technologists actually have to go down and take x-rays of that body part or of a particular area that they're looking at. So yes, a student would have to go down and actually most students should try to get a chance to go down to the morgue at some time because it's just something that's entirely different. It doesn't happen that often, but if we don't at least have some of our students subjected to that, then what's going to happen when they're on night by themselves and somebody comes in and they're called down to the morgue? I mean, it just can't be a surprise to them. They have to understand that what they are learning is very far-reaching. Not everything they do is just in their department. They go to the OR, they go to the ER, they go to patients' rooms with portable x-ray units. It's a lot of hands-on. It's a very high-tech and it's very hands-on with patients. So you can't be afraid of going in and touching and working with patients. There are invasive procedures that you have to learn. It's not, I mean, they will have to, if you have a needle phobia, you have to get over that because sometimes we do have to give patients injections and those type of things. I want the public and I want the students to know just really how hard our students work to get through these programs. They are not easy programs. It's a patient care related, but it's also a technology related things. And the things that are going on right now in all the hospitals around here, the things that have happened so fast is that the digital explosion, the x-rays are still produced the way they were when Wilhelm Röntgen discovered them in 1895. And we've gotten a little bit better with our generators, but we still produce them in the same way. They are man-made. However, the acquisition of the image has changed tremendously. No more are we using films and darkrooms and processing. Everything is on a computer. And so these are a lot of things that we have to learn to deal with and to learn. Most of our students are very good. They catch on very quickly. However, if you don't learn how to position the body part right, if you don't learn how to use proper radiation protection, then we're not educating you the way that we should be. And so it's a long program. The 2-year associate degree program, 6 semesters, it's 92 credits. These students have to get a lot of information, and it really has to do with our professional organizations and what they require of a radiologic technologist and a nuclear medicine technologist, an ultrasonographer. Lots and lots of education and continuing education. Even after they graduate, they're going to learn more and they can go into other fields.
For Techknow, I'm Lacey Rudolph.